So, Yasmin, we are so excited to have you here at NOFAS.
Well, thank you, Kathy, and it is my pleasure, really. I enjoy just having that interaction with you. I've enjoyed it over the years, and so this is just a perfect way to continue that interaction. I am, an admirer of your work and people at NOFAS as well, and so I really believe in the cause of people with FASD. I think this is what we should be doing. So the University of Louisville Fetal Alcohol Spectrum Disorders Clinic was actually started in 2008. We are an interdisciplinary clinic, so we have a developmental behavioral pediatrician, and then we have psychologists. We also have occupational therapists, speech language pathologists, nutritionists. And so we have this rich group that we can talk to and really learn a lot from. We are now trying to train more people through the CDC regional training centers, a whole host of people, medical providers, who now understand that FAS and FASD really go beyond the facial features and the growth deficits and really go into how the brain can affect behavior, how the brain differences can affect learning, and so that the child with FASD may present with just those particular features of brain difference rather than the facial or growth deficits or parameters.
Does insurance or the lack of insurance, is that a barrier to entering into the clinic? Will you see people with medical assistance or Medicare, for instance?
Absolutely. In the clinic itself, actually in Weisskopf Child Evaluation Center as a whole, we see about 50 to 60% passport/Medicaid, which generally this is sort of governmentally funded programs. And then the rest would be private insurance. There are, of course, those who are self-pay and those that are paid for by the school system or by the early intervention services. So it is possible. There are many routes to get into the clinic. Primarily, it is through referral from a pediatrician or any kind of medical provider.
Certainly in my situation, I think it's very clear when you raise a child with FAS, you want to prevent it from happening to any other family. But how did you get involved in this, and where does your passion for the issue come from?
Well, I'll tell you, Kathy, I started in 2006 to really just get interested in this. Well, in 2006, I was a new faculty member of the University of Louisville. I was starting at the Weisskopf Child Evaluation Center, being a developmental pediatrician, diagnosing children, and one mother asked me, "So what do you know about fetal alcohol syndrome?" And I was, quite embarrassed that I didn't know that much. So what I did was train myself. I think a lot of learning in medical school and or beyond really involves searching far beyond what you were taught is the truth. And I think it involves training yourself for what people really need from you. And at that time I realized I believe when she was telling me, actually the mother was telling me, there is nobody in this state who is doing work with fetal alcohol spectrum disorders, not a clinician. And so I want to know, do you know much about it? So I actually started by reading about it, and then I encountered the CDC criteria, and then went to Diane Malbin's training in Portland, Oregon. So thank you, Diane. She's really, she was quite inspirational in that 3 days that I was with her. FAS and FASD is a real issue. It's a public health issue, and it is something that we can all do something about and work on.